Well, Dr. Yogan Pillay is the Deputy Director General at the Department of Health, and we chat to him now on the line. Good afternoon, Doctor, and thank you for your time on the PM News Desk.
Good afternoon, Keshni, and good afternoon to your listeners.
Doctor, when did you first receive reports that something was indeed amiss, and when were the first batch checks performed?
So, Keshni, let me back up a little bit and explain how these checks are done, so the listeners have a context. When a patient or a person is tested in the public health sector, we do two tests. The first is called a screening test, and the second is called a confirmatory test. And only if those two give you the same result will a patient be told whether they're positive or negative. If there is a difference, so if the screening test says positive and the confirmatory says negative, that's called a discordant result. The blood of that patient then is sent to the laboratory for a third test called the ELISA test. And only after that test result is available will a patient be told whether they're positive or negative. Now, in this instance, it's the screening test, one of the screening tests, because we have different manufacturers providing these tests. The screening test from one manufacturer was found to give more false positives than we would expect. So we've recalled the batch of that manufacturer only. So not all tests are involved. It's only one batch from one manufacturer, which was used as a screening test that was recalled. Now, the important thing to note is that as a consequence of these checks and balances that we have, no patient would have been given the wrong result. So every patient that had the results given to them would have had the accurate results given to them because of the checks and balances we have in the system. Now, to answer your question, we noted this in the Western Cape about 3 weeks ago, and we then started a process of investigating and recalling that particular batch. This particular batch, the tests from this batch were used in the Western Cape and KwaZulu-Natal, and the batches that were sent to the other provinces, the other three provinces, were not used. So we've quarantined the batches that went to 3 provinces that were not used, and we've recalled the remaining tests from KZN and the Western Cape, and we've quarantined them. And all provinces now are using a different manufacturer's test to do the screening.
Yes, Doctor, what happens in the case where people have moved out of their area they were tested in? How will you make contact in these cases?
So with every patient that we have whose test was discordant and who had an ELISA, we'll have the patient's details, and that patient will be requested to come back to get the test result. This is a normal thing. So even if you are positive and you need to be started on antiretrovirals, we will ask for what's called a CD4 test to be done. And before you initiate it on treatment, you need to have a CD4 test done. That result will come from a lab. You will be asked to come back, and you will then be put on treatment. So this is a routine that happens in every health facility. So what I'm saying, Keshni, is that there are any number of checks and balances to ensure that patients get the correct result and are recalled to get the result if the lab test is required from an off-site lab. All right. Like a laboratory far away.
Yes, Doctor, we understand that this batch failed in the field, but passed the required lab tests. Are there any guidelines in place right now for regularly comparing test results? Would those results obtained from more sophisticated lab tests? And are these being implemented at all our health facilities right now?
So let me explain to the listeners how it's done. So when we purchase tests from a manufacturer, there's an obligation on that manufacturer to send us samples from each batch, which we then send to the National Institute for Communicable Diseases to be tested. So it's our internal quality assurance program. Now, as you can imagine, because these batches are large batches, not every one of those test kits are tested. It's a sample that's tested, and then we put it into the field. Once it gets into the field, we have an additional set of checks and balances where we monitor exactly what we found now. So what we found is a consequence of our monitoring of what happens in the field. And as soon as we found discordant results in the field, we then quarantined those test kits, isolated them, and replaced them. It's because of our second set of checks and balances after it's been quality assured by the National Institute for Communicable Disease.
Dr. Yogan Pillay from the Department of Health, thank you so much for your time on the SABC News Desk.